I'll absolutely go ahead and start. And just as people are still popping on here, it's really good to see everybody tuning in. And the intent for today is to provide just a little bit of an overview on some of the changing metrics that we're seeing from the county perspective, especially with the color tier system in place. And also talk a little bit about how the changing colors or the changing tiers impact schools or how it doesn't impact schools. And also provide an opportunity for folks to ask some questions, I think, to the group, and provide additional information to folks regarding some of the metrics that have been put in place by California Department of Public Health back in July regarding schools and some best practices, and really provide an opportunity for folks not only to access that information, but to maybe clarify some of hypothetical situations or current situations. There's no doubt that this has been one of the most challenging communication situations that I think any of us have ever really tried to deal with or handle. And I know that's not just the case here in Mariposa, but that's the case across the state. I know when I talk to my superintendent colleagues across the state, they're dealing with that as well, because the information changes so quickly. There's different sets of standards for businesses versus schools. And that continues to change on a daily basis. And so I think Eric probably has a similar story in the health officers world across the state. And you don't necessarily get the same story sometimes in each and every county. And so I think today's goal is to just touch base with everybody and provide an opportunity to talk a little bit about what the red tier is going to do for our entire community. But also talk a little bit about if things do change or conditions may change on the ground here in Mariposa and how that could impact schools, and also provide a little bit more clarification for this group and for the community as a whole about some of the ongoing conversations that Christina and myself and Eric have, and also our school board's stance on a lot of these items as well. So I think that's the goal for my perspective today. Eric, did you have anything as far as you wanted to share regarding goals for today's meeting?
No, again, we both, Christine and I, wanted to make ourselves available for both students, faculty, and family, parents. If there were any questions, also in terms of stage setting, we do know that there is a surge of cases going on in the state. That this is kind of what we were expecting back in March, is that we would get into the flu season and start seeing cases. And then the question is how do we maneuver in that space, in that environment, in the school setting? And so I wanted to be available to answer some questions about that. But both Christine and I will probably have, sort of set the stage, and then we can go from there.
And is there a way you think, Eric and Christina, that we might be able to start off with just providing a little bit more of an overview for folks about the tiered system that we have in place now? This summer it was a numbers metric system, and now it's a colored tier system. And how unique it is, because it does impact our county, but at this point, kind of maybe talk a little bit about how it doesn't impact, in some cases, our decision to either transition to distance learning or remain in in-person instruction. I know that's brought a lot of confusion for folks as they stay tuned to the colored tier system, but ultimately we're in a different system for schools.
Right, and what I can start with that if we're ready to launch into it, and sort of tell the story of the last 8 months, because I think it's important to start with where we were at in March. And talk about, March 18th was the statewide stay-at-home order, and really things were already shutting down in terms of schools, because there was kind of this wave that started from Southern California and moved north. And so as we ended the school year last year, it was under the stay-at-home order. And then we came out, or the state developed what's called the roadmap to reopen the economy. And so that was launched on June 12th. And that allowed for sectors to slowly open up. And you'll probably remember us talking about stages at that point, and kind of almost making fun of it because each little creep along. So we were at stage 2.98 when we started to see an increase in the number of cases throughout the state of California, which led to the July surge. And the July surge led to the implementation of what's called the County Data Monitoring List. And the County Data Monitoring List was looking at those counties that had both a high case rate, that is cases per 100,000, and a high test positivity rate, and implemented in those counties that were on the County Data Monitoring List controls, whether it's restaurants being closed, bars being closed, things like that. And that County Data Monitoring List evolved into what we have today, which is the Blueprint for a Safer Economy. And the Blueprint for a Safer Economy, as Jeff alluded to, is a 4-tier system that goes from the least restrictive being the yellow tier or tier 4 to the most restrictive, which is the purple tier or tier 1. And those tiers are based upon 2 metrics. For larger counties, they use a case rate per 100,000 to move backwards. For us in Mariposa and any county that's smaller than 106,000 in population, and for those of you who are wondering, 106 was chosen because the health officer who is in both Yuba and Sutter covers both those counties, and so they didn't want her to have to deal with 2 different sets of metrics. So for the small counties, we look at an absolute number based upon sort of derived numbers from the case rate, but what they wanted to do was not penalize the small counties in terms of a single cluster, pushing them back into a more restrictive tier. So small counties like us, we look at the total number of cases in a given week as an absolute number, and then the other thing we look at is test percentage positivity. And so those 2 metrics combined dictate which of the 4 tiers that we're in. And so going back to September, when we started, we were in the orange tier, and then we were able to move in the yellow tier and remain in the yellow tier for several weeks until about 2 weeks ago when we started seeing an uptick in cases. And then currently we went from the orange tier into the red tier. And at the same time we were making those moves backwards, the state was kind of, I will say, moving the goalposts, but expressing a good reason for doing that is they were concerned because we were seeing a surge of cases in Southern California, specifically Imperial County, but radiating into San Diego, up into Los Angeles, and really continuing up into the Central Valley. So, where they wanted to be looking at, rather than one look at the data per week, looking at the data twice a week, and then also looking at the data more close to the time of analysis. When we started the blueprint, we were looking at 2 weeks worth of data, so the average of 2 weeks worth of data with a 1-week lag. At present, we're looking at 1 week's worth of data, and it can be either a 4-day or a 7-day lag for when we look at that data. So we've gone through a couple of analysis while in the red tier, and because of that absolute number, which would have to be greater than 35, I don't see us moving into the purple tier, at least for the next week or so. But again, because they're looking at a week's worth of data with a week's lag, we could be, again, if we accumulated a number of cases over this week, we could be in the purple tier. So getting to Jeff's statement about education and the correlation between the tiers and educational services is really the only thing that ties the schools to the tiers is that most restrictive tier, the purple tier. So if schools have not opened in the purple tier, they cannot open until they've been in the red tier for 2 weeks. The exception to that is that elementary schools can ask for a school waiver while they're still in the purple tier. So that's really the only tie in terms of the blueprint and the educational guidance. So if we were to move back into the purple tier and we closed a school, then we'd have to wait to go back into red to open that up, unless it was an elementary school and we asked for a waiver related to that. And it's the school district that initiates the waiver. So as we look at the increasing number of cases in the state and the potential for even Mariposa County going into the purple, moving into a purple tier would not cause us to close our schools down. And in fact, in conversations with the state and with other health officers, there's really a strong desire to keep schools open, especially in schools that are residing within one of those purple counties, which I'm going to look over here. We are one of 5 counties that are in the red tier and one of 6 counties that aren't in a purple tier. So Sierra happens to be the only county that's in orange, and there's no one who's in yellow. So those are kind of the restrictions around businesses and other sort of functions that aren't schools. What I'll say about schools is, in terms of, and you may have heard this before, is that the CDPH and CDE looked at criteria for closing schools, and for an individual school, it's 5% of the typical population of that school, including staff, faculty, and students that reside on that campus. So I'm just going to say, as a guess, and I don't know if it's really true, if Mariposa County High School had a population of 500, including both staff and students, and 25 or more of those students were, 25 of those people were ill in a given 2-week period, that would close that school. And then if you have more than a quarter of the schools closed due to COVID illness, then that would push the school district to close. So those are really the metrics that are independent of the tier mechanism. But if we were to close and be in the purple tier, then we couldn't reopen as the high school. Christina, anything else that I should be mentioning?
No, I think that's good. I think that was a good overview. Just want to say, we really want to open this up to any questions you all might have. So there's the chat box. I did post a link for more information on the blueprint and small county variants in the chat box if you're interested in reading more about that. It also has a section on schools that you can read about, everything Eric just went over.
Right.
Go ahead.
No, I was going to say, I see there's at least 2 questions in the chat box, and I'll just go ahead and knock those out right now. Is the 5% is lab confirmed positive tests, not just those staying home at sick, because we do know that there are other reasons to being ill, and one of the things that we've worked on with the school district on algorithms is finding those alternative diagnoses, whether it be a rhinovirus, a flu virus, or something along those lines. And then the question, shouldn't the number be adjusted based on staff and students in person instead of the full 500? And again, it would be not necessarily in person, but who would be on that campus in a given week, knowing that there's kind of an A and B side, but that the teacher serves as a connection between those. So you could actually have transmission between the 2 separate, I got to remember, Monday, Tuesday, Wednesday, Thursday groups. So there would be the possibility of transmission that means we need to include the entire population.
If I can jump into, Eric, I think to Mighty's question, and I want to go back real quick and just and I appreciate you giving such a thorough overview. Just to let everybody know, in the conversations with the governor's office and also the state superintendent, they have both been very committed to the decision to reopen to in-person instruction or to close is a local decision. When they changed the tiered system and people were in counties were in the purple, as Eric said, if they were closed, they were going to have to remain closed. But if they decided to stay open, it was going to be a local decision, and the 1,007 school districts across the state and those individual boards were going to be making those choices. And so that's kind of how we've ended up here today. I think just real quick to Mighty's question, in my call yesterday with the county superintendents, the other 57 of them, with the governor's office as well, they are in the process of attempting to try to collect and gather all of this data of not only just all 58 counties, obviously, but schools and all the different school districts. So there is not a one-stop shop right now that Sacramento can click on and see the status of every single school district. We're literally in the process of creating and developing that dashboard so that things like, shouldn't there be different considerations for in-person versus distance learning? Those are things that I can tell you right now that Sacramento has not considered yet. And they're in the process in real time working on not only trying to get feedback for questions like that, and that's a question that I'll take back to my county SUPS meeting, but they haven't even provided an adjustment to the CDPH guidelines based on a question like that, because they simply just are still in real time and they haven't got an assessment of where all the school districts are across the state. And so they're very much behind. And in a lot of cases, I'm seeing examples of folks like us here in Mariposa that are open up for in-person. We're providing Sacramento information as it relates to returning to in-person instruction, because a lot of the districts across the state just simply aren't there yet. And so we're seeing we're the first district in some cases to see some of these challenges and provide that feedback to the state.
Right.
And Christine, I'll let you kind of take the lead as far as questions go, or is there a specific way you'd like to kind of go through them?
Yeah, I think if you want to put your question in the chat box, we'll get as many as we can. Also, you can unmute yourself if it's more comfortable for you to just ask your question. Either way, it's fine with me. Eric, do you agree?
Yep. No, I think if people want to put questions in the chat or amplify or ask, so like with Ben Jewell, he says he'd like to talk about the small county variance, and is there a specific question, or what would your thoughts be about that?
I mean, it's not a specific question, but I was just sort of running the numbers, and I looked at the link that Christina put up there that allows counties under, 35,000 to reach purple once they have 35 cases in a week. Well, 35 cases in a county of 18,000, which is Mariposa, works out to something like 193 cases per 100K. So 193 cases per 100K is about 4 times the threshold for the rest of the state per 100K on a 100K basis. The rest of the state has to have 49 cases per 100K per week, and we have to have 193. So it's like Mariposa really has to be doing 4 times as worse, 4 times as bad to reach that purple tier. Similarly, with the other tiers, it ranges from 2.5 times the state average to 5.5 times. If you were to look at our current range, the Mariposa orange is equivalent to California purple. So it just, I think that I understand the need for an adjustment to this when you're talking about small numbers when you're approaching 0. I mean, I'm a stats teacher at the high school. I understand how it's difficult to note 0, but once you're above a certain threshold, it seems like, I don't know, that's a big adjustment. I feel like we're not comparing apples to apples when we say that Mariposa is at purple with 35 cases in a week, and it would only take 14 more on a 100K base. Well, I think I've made my point.
Yeah, and I appreciate that, and I'll say, it's the rules we're dealt with, but also it's a recognition that you can have what I would have liked is more of a qualitative, but it's hard for the state to have a qualitative measure. What I'd like to, when we were discussing this way back when, was the idea is not so much what is the number, but can I get my arms around that and contain that? So say it's a single cluster of cases within, say, an agricultural plant, and I know I can contain it there. I would feel more comfortable with that. I would say the other important part, though, is the percent positive does not change because of the county. And so if we're under testing and we're not able to estimate prevalence in the community, then that would push you back into a more restrictive tier as well. So I think that's an important metric that we keep an eye on as well.
Thank you.
All right. So for Lisa, when you say classroom be closed, is that like physically closed or like taking a cohort out of school?
That would be an individual classroom being closed, because if somebody tested positive, either a teacher or a student, because I was under the impression that if somebody tested positive, that a classroom has to be closed for at least 24 hours.
I'm going to defer to, I don't think there's actually any written guidance on that, but I'll defer to Christina if she knows something. But again, what we know in terms of transmission is, and maybe Jeff has something from a CDE guidance, but what we know from transmission is that fomites, that is the schmutz that's left on desks and stuff like that, is the least likely mechanism for transmission. And so just by cleaning high touch surfaces, that reduces that risk. And then, you know, of course, the most prevalent way of transmitting is droplets, and that's why we have people wear masks and contain that schmutz that you're sneezing or breathing or singing out. And then the third that's in between and really uncharacterized is what's called aerosol or airborne transmission, which are finer droplets that hang in the air for a while.
Yeah,
but,
and I think that that rule you're referring to was a rule early on, and that was prior to any schools being open. And it was something that was in their guidance in the first round. They've been reiterated many times since then. And then the other thing, and I think it was you too, Lisa, that asked about what does it take to close a classroom? We'll go back to those what it takes to close a school kind of metrics. I will say that closing one classroom would be up to the school and the school district. That would be their decision if they didn't hit that 5% metric yet. It's not our call. We can give a recommendation, but as you may have seen today, the charter school in Cathays Valley put out a letter that they are going to close one of their classrooms. They just felt, based on their assessment, that it was the safest thing for them to do at this moment. But that was their choice. They had that choice to make, and that's what they decided to do. So it's not a decision that would necessarily come from public health at this time.
And Lisa, I can tell you from a school district's perspective, our practice has been in working with public health is once an individual has tested positive and we receive that information from HHS and know that that individual is then isolating, any additional folks who may have to self-quarantine, whether they be students or staff members, based on being considered a close contact, those individuals would also go into self-quarantine. So we haven't had an example where we have transitioned an entire classroom to distance learning based on positive cases or associated individuals who may have to self-quarantine. And to Christina's point, that has been something that, as I stated at the beginning of this, has been difficult to keep up with because this information continues to change and evolve in real time. So.
All right, and next, Lisa's asking about modified quarantine. So modified quarantine is available to essential workers in healthcare and law enforcement, and it's a case-by-case basis. If someone is put onto modified quarantine, that means that they can go to work and home, no stops in between, and they have to do twice daily symptom checks and wear a mask at all times. Does that answer your question on modified quarantine?
Does that apply to the schools and to teachers?
No.
Yes, it does.
It's a caveat.
Yeah, it's a caveat, is that if you look at the definition of critical infrastructure worker, it does include education. And so we had made the assumption that teachers could do modified quarantine, but Christina, along with discussion with the teachers, the school district, et cetera, took modified quarantine off the table. And that was a couple weeks ago, Christina?
Yeah. Yep.
Okay.
Oh, good, because that doesn't make much sense to me. I mean, I understand it for a healthcare situation, but it seems to be counterintuitive in an education setting where we're trying to minimize the spread to people that aren't infected. So that's off the table, is what you said as of now?
Yes, it is.
But as of 2 weeks ago.
Yeah,
Okay, great. Thank you.
from a school district perspective, Lisa, that is now not an option. I think early on, back in March and April, when this was taking place, there was talk that the governor may kind of take that next step and declare certificated staff members and classified staff members, I think, disaster workers, something along those lines, which then would require them to show up. What Dr. Surjenko is talking about is, I guess, a step below that from actually that taking place, and the governor has yet to do that. So
yeah, so two different things altogether. So if you want to Google critical infrastructure workers, there are 16 sectors in society that are felt to be critical, everything from agriculture to healthcare to education. And it's the pieces, parts that keep our society going. And again, education is one of those. And so it would be permissible under the guidance from CDC and CDPH to have critical infrastructure workers stay on the workplace in that modified quarantine. But again, in discussion between Christina and the school district and the teachers union, it was decided that that was not suitable or not the right thing for Mariposa County. And so that went away about 2 weeks ago for the Mariposa County Unified School District.
All right. Brian's asking, will we be basing our numbers off of all students, just in person, or a completely different metric?
So it'd be all students that are in person during any period of time during the school week. And so if you've got students, so it wouldn't include students that are doing distance learning only. But people who are physically present, regardless of whether they were a Monday, Tuesday, or Wednesday, Thursday cohort, because again, you guys overlap in terms of staff and faculty.
And if I can add to that too, based on CDPH's guidance, Eric, one of the things that I'm working on at the state level to identify as one of the unintended consequences is CDPH calls for if 25% of the schools have to close due to positive cases, then you should close the entire district. One of the issues that us small rural counties have come across with that guidance is, for an example, and we highlighted this back in July when this initial guidance came out, was, if we had a situation where we needed to close Greeley Hill, El Portal, and say Yosemite Park Elementary, the guidance would then, with those statistics, would say that we need to shut down the entire district. And so there is conversations about maybe adjusting that guidance to where a situation like that, we wouldn't have to close down the entire district if you had 3 or 4 smaller schools ultimately be the foundation for having to close an entire school district. You could actually get into a situation where anywhere from 10 to 20 kids across the school district, if necessary, small schools could shut down an entire district. And so that's just an example for everybody to see how this continues to change and evolve based on the original guidance that came out, because as districts are implementing this in real time, they're seeing some of the challenges or unintended consequences that are popping up because of the guidance. So.
All right. Reading from Paul. One concern with the 5% metric is that some sick individuals may not get tested. At our site, we've had many students stay home 10 days due to multiple COVID symptoms. Few of those families chose to get tested. To take it to the extreme, if no one gets tested, we never have to close.
Right. So I think all I have, at this point, you'd think about what are the other tools that are already in your toolbox before COVID. And we have closed schools because of influenza outbreaks or because of norovirus outbreaks. And so if it got to that concern and I will say it's more than 5% of the student body, but I've worked with principals before for both norovirus and for influenza outbreaks. So I don't know we'll ever get to that extreme point, but I also think from a advocacy point is that we do want to get people tested, and we do have the availability of getting people tested for free. And so that's something that I think as a school district, as a teacher, me as the health officer, is we advocate people to get tested when it's available and easy enough to do. Because again, not only does that give us an individual answer about that person, whether they've got COVID or not, but it gives us a closer to a true prevalence of what the disease burden is on the community.
All right. Mighty says, I asked about the models we were using to make our decisions back in September, and this site was cited. It's the CalCap site. Should we not be concerned that the R effective value is now estimated to be at 1.3?
So yeah, I was looking at that too, and I think there's again, small county, there's volatility associated with that. So if you look at, if you're looking at it, look at Tuolumne as well. So Tuolumne has a percentage positive that's up in the 40s and has a case rate that's up in the 40s. And yet their R effective is less than ours. So it's that snapshot in time and trending it. So if you look at one piece of the picture, I won't say it's wrong, but I don't necessarily put value in that 1.31. But I think it's, again, we look at it and trend it. So, but thanks for bringing it up.
All right, and Brian, we may have answered this already about your 5%. It's the student body that and staff that are on the campus at any given time in a week. Okay, and it sounds like the school and the district can make a decision as the charter school did this week. So does MCOSD have a metric set out? Assuming to shut down the classroom is what you're asking.
Yeah, I think the board and myself have been committed to the July guidance from CDPH in collaboration with obviously Christina and Eric as well to the 5% metric. And at this time, based on the top of the case we've seen, I think, Eric, it's safe to say that we haven't come close to that number at this point since returning in October, since October 12th. So yes, Brian, the board has the ability to make that decision. At this point, based on our October reopening guidance from the board, there has not been any follow-up decisions made about transitioning or changing from that direction and following CDPH's guidance in our continued collaboration with Eric as well. But if that does change, obviously we'll make sure we communicate that.
All right, and Paul asked, are you able to share the numbers that resulted in the classroom closure at Cathy's Valley today? I will tell you that the Sierra Foothill Charter School put out a letter that said that a student was tested positive for COVID-19. Okay, next question says, how many of the new cases are in our school system, staff and students? Also, what is the guidance on reporting cases in the school system? That is a number that I do not have in front of me. But our guidance on reporting cases is that our contact tracing team will identify if that person is employed by or is a student of the school district, and we connect with the school district nurse and or superintendent and make sure they are aware so that they can make their decisions going forward. But we do all the contact tracing here at Public Health, and those contacts are contacted. So far, we've maintained a 24-hour, within 24, and even shorter than that, actually, within 12 hours, we've been able to contact all cases and contacts associated with the case.
And I think too, it's a good question as far as our communications, the change you're going to see in the coming weeks. You know, when this originally started, those communications and letting the general public know and staff know and parents know what the process was going to be for individuals who tested positive, and also letting folks know the process for what happens when some staff members have to self-quarantine. That communication is going to be handled by the assistant superintendent's office at this point now, and not be as long as it was originally in the first 4 or 5 cases. So that information will still be provided publicly. And I think ultimately, as we shift to that transition to having the assistant superintendent's office in collaboration with public health provide that information, you'll see a far more succinct communication going out and letting folks know when either staff or students have tested positive at specific sites.
Yeah, and I'll just mention, as a public health, we cannot release information based on where a case is within 20,000 population. So we're not going to specify or release any information that says this person was a student at this school or lived in this part of the county or any of that. We can't do that. So we release our case updates when we have them every day at 4:30. And then if the school wishes to take that message further, they can. All right. Another question on behalf. Okay, so what is recommended for people who live in Purple County but work in a red county? Should the governor put a stay-at-home order in place for purple counties?
Stand by on that one. As any of you who saw the governor's or press conference or read a newspaper or heard a radio story about this, is the governor is considering a stay-at-home order for purple counties. We don't know what that's going to look like. We know there is something in the works that will probably get announced tomorrow. And I guess that is an operational question for Jeff and the other district leadership, is if you have a teacher who's residing in a purple county, by definition, and we don't know what if it's truly a stay-at-home shelter-in-place order, then that person may need to stay at home. And so we don't know what that's going to look like. But as soon as we do, we will share that. And to be honest, there are many times that we get a guidance at the same time it goes out to the general public, or get it like a half day or the evening before. So we do our best in getting up to speed and getting word out to people about that. So to Brian's point, don't know what action at this point needs to be taken because we haven't been given any direction on that. But again, if there was a stay-at-home order for purple counties, it may apply and may impact school operations.
And I can say we're kind of sitting by and waiting as well. I can, based on my call yesterday with the state, or at the state level, the governor is very interested in allowing options to keep schools open. He's very interested in continuing that effort. And so I think I answered this question to MCTA's president earlier today. And barring an executive order from the governor's office and looking at his previous actions, which is basically leaving the schools alone and leaving that up to the local school boards to make those decisions, unless he comes out with an executive order specifically stating that school district employees need to remain in place or shelter in place, I would anticipate that schools will still have the flexibility to remain open in a stay-at-home order. That could change, as Eric discussed earlier. So we'll see if the governor takes any additional steps to be more specific on schools, asking folks to stay at home. I would, just based on what I have seen at this point, everything does point, if you're just looking across the state and really the nation itself, it seems that the trend has been that more and more school districts are working to stay open, whether it be through the waiver process in those purple counties or even in some of the larger urban areas. There seems to be a little bit more of a consensus of the effort is that we should try to keep schools open. It doesn't mean that can't change. So we're kind of, as Eric said, we'll wait and see if the governor provides any additional information as it relates to specifics for stay-at-home orders in schools.
Thanks. And Brooke, to your question, 500 was just an example that Eric used to do easy math. Jeff will know, and school administrators will know how many students or staff are actually on campus. I don't know what that actual number is. It was just an example.
And that's a good question. I think that what I will do is continue to take that information back to the county superintendent group, because I think that's another example of folks just trying to figure this out in real time. And in July, when CDPH came out with this guidance, there wasn't a ton of discussion regarding hybrids or in-person or anything along those lines, or alternative models, I should say. So I'll take that into consideration and see ultimately, I know Eric as well, if that might be something in conversation with other health officers, if CDPH would be interested in taking that into consideration and adjusting and updating their guidance as well.
Yeah, or making more specific examples. And I will say, yeah, dropping the distance learning students it makes incredibly good sense. I think probably the area of discussion is if you're in a hybrid model. I would think the population at risk, that is, who could be exposed, would include both groups that are on campus, even though they're on different days, because the teachers can serve as a nidus for transmission between the two subpopulations. What's a close contact? So that's someone who's been within 6 feet for 15 minutes or longer. But what in SC, you can correct me, is that so if there was a member in the class that was determined to have been a close contact, that person would go into quarantine, but the rest of the family would not necessarily have to, and actually shouldn't. So they're what we call contacts of contacts. And so unless that student who is quarantined became symptomatic, then the rest of the family would not have been exposed to the pathogen. So they would not have a need to quarantine. Now, the challenge that we've seen, and so let's follow that example out a little bit, is the student who is exposed is a contact, is quarantining, but isn't able to say, stay separate from the rest of the family, and then he or she becomes symptomatic, then the whole rest of the family would have to quarantine, as now they're no longer contacts of contacts, but a contact.
All right. And the next question, maybe Jeff can take. Approximately how many staff live in counties other than Mariposa?
Well, John counts as one. I know that. John, I'd have to get that information for you. I don't have that off the top of my head.
All right. The 20,000 population size ceiling on reporting reference by me appears to be up to the discretion of the county.
Yeah, so the history behind this was we have what's called the Yosemite Gateway Area Coordination Team, which includes the 4 counties that surround the park and the park itself, but I was able to engage the county councils of all those counties, and they asked them to do research. What's permissible under HIPAA and the privacy information, and there was this level that was put out about 20,000 in pop, and so I recognize that other counties do smaller things. And I think actually the challenge is at this point is, you have to, the risk is there regardless of where you're at in Mariposa County. I think that's probably the takeaway message, is even if we told you that the case lived on Quail Ridge Road, which is where I live, that you should have the same behaviors that you have wherever you go in Mariposa: wearing a mask, watching your distance, washing your hands, because we want those behaviors consistently across the district. But getting back to Fresno, I think why they're reporting smaller populations is as we get more cases, and again, Fresno has markedly more both by case rate and by sheer number, is you can go to smaller populations and still maintain the privacy of an individual. And I suspect that's what their county council is looking at. So as an example, you could probably even in Tuolumne at this point, given their case rate and number of total cases, go to a smaller geographic area and still not violate someone's violate the privacy laws. Here, I don't know so much because we really are still only at 120 odd cases.
Right. I don't see anything else in the chat box, so feel free to put your questions there or unmute if you have any others.
Hey, Christina, this is Mooch at the high school. And I actually had another question for you and also for Dr. Sojenko as well. Not so much focused specifically on the schools, but just kind of the county in general. We've been watching the cases continue to rise. And I mean, we've unfortunately jumped from yellow to red in like a week. Is there work that's being done in the county to kind of move towards not even necessarily enforcement of some of the policies and mandates, but are actions being taken to kind of help some of the preventative measures that have been put out there, and to encourage people to follow them and abide by them, businesses as well? I know that it's a challenge, and I know that mask mandates have now become a politicized culture war, more so than just preventative measures as a global pandemic rips through our country. But is the county going to be taking any sort of actions to kind of help with that? Are we still kind of focused on the education aspect of it, or are we going to be moving more towards an enforcement mentality at some point in some way?
So I'll grab that one. So the question is what can we do within Health and Human Services? Because, again, enforcement, writing tickets, arresting people, that's the lane of the sheriff. And, in discussions with Sheriff Benoist, he doesn't necessarily feel like there's a need to enforce, and I don't know that you're going to be able to move that. That said, within Health and Human Services, we did distribute CARES funding to businesses, and adherence to the state guidance is part of that. So we can reach out and have reached out to businesses that we've noticed received CARES funding but has not been as compliant with state guidance as they ought to, and been able to get some better behavior because of that. And then the other thing is that our environmental health section, because they regulate restaurants' food permitting, is that if we have a food business that is, again, not compliant with state guidance, we can warn them. We can't cite them because we don't have citation authority, but we can go as far as closing businesses, and we've come close to that a couple times, and then people have become compliant. But at this point, that's kind of the level of enforcement we can do at a county level. And then the other thing is we work in conjunction with the state law enforcement or the state enforcement task force, which includes people like the Alcohol Beverage Control Commission. And so their officers can come out and do some level of enforcement. It's been a while since this ABC's been up here. But if we, they're putting their priorities into places that have higher prevalence of cases. So if we were to bump up, it's kind of like counterintuitive. I would rather have them up here sooner rather than later, but it is what it is.
All right. Oh, just lost me.
Thank you.
You're welcome. What happens if we have more than 5% of staff testing positive, but the students are far below 5%? Will the school stay open if we can find subs? So the 5% refers to staff and students collectively. So the 5% would include staff as well.
Yeah, and I appreciate the question. Oh, go ahead, Eric.
Oh, no, I was going to say, you have to do math. So if there's, yeah, it's a 5% of the total population, not of either subpopulation.
Right.
And I can add to that, Jen. I think one of the things that we have seen during this reopening since October is one of the biggest struggles that sites have is when staff members either test positive or are identified as a contact and need to self-quarantine. In a lot of ways, Jen, this is the metrics then actually go out the door following CDPH. Is that right? Yeah, California Public Department. Yes. Because it becomes an operational issue. And so we've seen in a couple examples already since reopening that aside from health and safety, we have had situations where we've had to consider possibly transitioning to distance learning because we simply just did not have the staff to fill the vacancies when staff members are out. We know that we have a sub shortage here, and this is not just unique to Mariposa. This is a struggle for the entire state. Districts across the state is, when we follow, our goal is to mitigate the spread of this virus. And when we're doing what we're supposed to be doing by following the process and protocols, and staff, do their self-quarantining and their isolation, we get into situations where it becomes very difficult to backfill those positions, either with aides while the staff member teaches in a virtual setting, or simply just being able to provide enough substitutes to provide supervision. And so it's an issue that the board is very aware of. I know my team's very aware of, and also site administrators, because everybody is, when those situations pop up, everybody is scrambling to try to provide first and foremost supervision for the students, so that the teachers can focus on their health and safety first. And then if they can provide instruction through a virtual setting, we're happy that they can do that, but then we still have to backfill supervision for those in real time. So we're going to continue to monitor each and every case, but we are prepared with the board support to transition to distance learning in situations when it becomes an operational issue, as opposed to a CDPH guideline health and safety issue. Good question.
All right, and then there's another question here. Is there new legislation going into effect January 2021 that requires the district to notify families if someone at a school tests positive? And is there a variance for small counties around this notification? Not something I'm aware of. Jeff, are you?
I am not aware of that. I know that we have a couple different things. So first and foremost, in being transparent, we are providing that information to the public, including staff members and parents. Additionally, I think one of the things that we're considering as we continue to evolve in this process is how much information do we give, and what are folks going to do with that information? Because I know the state is looking to collect that data to almost mirror what we see at the county level with their data, but also just pertaining to school sites themselves. So although I'm not aware of specific legal language that is being considered, I know that we're working to provide that information on a case-by-case basis, and also as part of our obligation with our union partners, provide that information to them as well.
Thank you. AF has questions about surge, what Mariposa County is doing to try to avoid surge. And there's a lot of questions in here, so hopefully.
Yeah, no, what can we do? I think to boil it down is, what can we do to not be Tuolumne?
Yes.
Because I wouldn't necessarily use Santa Clara as an example, because they really haven't even gone out of purple at all. They were down in red for a little bit, but they've had a high rate of transmission basically since the first case in February, because that's where the first case was. And just for clarification, Tuolumne started out actually in orange, and they never moved from orange. And I think the challenge in Tuolumne was unity of message, having all of the leadership in the county at the county level speaking with one voice. And I do think that's where we've succeeded. But I appreciate everyone, carrying that message forward. What I've already said today is using those basic infection control practices and making sure that everyone's aware of them. And as I've also said, is that we don't have to be 100% perfect with them. If we get 70% of our population consistently adhering to those behaviors, then we'll see transmission decrease. And what we've seen is, we had this bump in cases 2 weekends ago. And really that had to do with family gatherings or gatherings of people over the Halloween. And so we may see the same associated with Thanksgiving. And so that's, again, one of those watchwords is family gatherings or friends and family gatherings, where you're meeting people from outside your normal bubble, and that increases risk of transmission. And so that's, again, another behavior that we want to discourage and encourage, is staying within your own bubble. And I'm being mindful of time. I have about 6 more minutes before Christina and I have to drop.
Yeah. So the 5%, Michelle, is per school. And if 25% of schools are closed, then the district must close. Iris, talk of doing testing on site for students and staff. Yes, as soon as your mobile health clinic is active, we will do that.
Yeah, to add another layer on that, yes, when the mobile clinic's in place, we've already talked with Camarena about using an antigen-based test there, which would give you results in 15 minutes or less. It's not as accurate as PCR, but it's much more rapid.
Okay, and last question. I had another question. Okay. Can you shed light on the decision to keep schools open but not offices? Surely schools with 15 plus people in a confined space can't be better off than an office building, 15 plus in a room for 90 minutes.
And I appreciate the question, and I appreciate this has been part of the difficulty of communicating to folks rationales behind closing offices or transitioning to telework versus transitioning to distance learning. So Brian, I really do appreciate the question and asking for additional rationale on these decisions. I think we're being very consistent across the district in following public health guidelines as it relates to what we're asking staff to do when they either A, test positive, or B, have been confirmed a contact. And so in a situation for staff members, say in a district office setting or a special education setting, those staff members are ultimately following public health guidelines, which is they're quarantining or isolating, and therefore transitioning to teleworking. Obviously, a situation at schools is a bit different because students need supervision. And so in a situation where the specific individuals have either been identified as positive cases and need to isolate, or have been identified as possible contacts and need to self-quarantine, everybody is following the same guidelines. And so ultimately, when an office is closed down because they're following the guidelines set forth by public health, those individuals are still accessible via telework, just as a staff member or a teacher is available to do distance learning if they're healthy enough to do so. So we are being consistent in the way in which we're implementing the teleworking or distance learning teaching option for staff members. And so I understand your question. I think the difference has to do with just how we're having to provide supervision for the students. And I think office staff, fortunately enough, doesn't need supervision in those situations and continue to do their work in a teleworking environment. And we make sure we notify on the office doors of how those folks can be accessible, and you can get in touch with those individuals and communicate with them. So it has less.
And I thank you for that clarification. I think the question was more focused just in general in regards to our tiered system through CDPH in regards to red and purple. With moving into a red tier, offices should remain closed, telework done best as possible. But schools can go ahead and remain open even if they blow into the purple tier. Today I had 15 students plus myself in a confined space for 90 minutes. And granted, yes, there were masks and hand sanitizer. But how do we see that as being safer and more sound environment than 5, 10, 15 people in an office building at the same time?
So I think it goes to the transmission dynamics of COVID. It doesn't really spread as well in even teenagers over 20-somethings, 30-somethings, 40-somethings. The 30 and 40-somethings are probably the best transmitters. And so, that's where when we started this conversation a while ago, my greatest concern was for teachers. Teachers with teachers is probably the most concerning area for transmission rather than from teacher to student or student to teacher. And so in the classroom itself, especially as you get younger, below, into the elementary age, there really is very little risk. And then where you start perceiving more risk, or there is more risk, is when you get into the university level. Getting into that age is that those aged people probably have the same, slightly less ability to transmit than the 20-somethings or 30-somethings into the 40-somethings. So that's the idea behind that. So again, in an office space, you have people that are, again, that working age 20 to 50, and they're the best spreaders of disease. Now, if we were talking about an influenza pandemic, then we probably would be talking about closing schools because kids are really good at spreading flu.
Yeah, I just think that, especially in regards to our case as well, our first teacher to test positive at the high school most likely got it from a student.
Right. And so, individuals will happen. I think that's, again, if you look at population health and drill it down to an individual, it's not always going to bear out to be true. But overall, again, individual cases will happen. But overall, the risk is what I painted out. So.
And I think, Eric, that would be, and I do appreciate Brian's question and point as well, because one of the most difficult parts of this is, from a school district's perspective, is our goal, Eric, we've talked about this, our goal is to mitigate the spread of the virus. Unfortunately, we're not in a position to contain it unless everybody just stayed home. I think what you say, about 2 weeks or a month, something along those lines. And I think ultimately for us, one of the difficulties is we only have so much control over students and staff for those 8 hours a day. And once, and I think everybody sees that when they leave campus, there are some folks who are obviously wearing their mask and doing things that they need to do while they're on campus and in a work environment, specifically students, I think too. But once they leave campus, we just don't have that kind of control over ensuring that those students are following the rules. And that makes this extremely difficult and tough. Because you start playing the chasing game of who had it, where did it come from, and that's extremely fearful for a lot of folks.
All right, we are over time and we have another meeting to be in at 4. So
it's in this same room. So.
It is. I see some of our people here. So thank you. I put our email for our information line and phone number in the chat. That's mariposacovid19@gmail.com. Or you can call 209-259-1332. And our JIC team will answer your questions or find answers for your questions. So thank you. And we can look forward to doing one of these again soon.
Yeah, if this was beneficial for folks, let us know. And as time permits, we will do it.
Thank you, everybody.